When I was 26, my husband and I bought our first house. It had a big open floor plan, a formal dining room, a soaking tub. It was in the new neighborhood where all my friends were moving. I had a 3-year-old son and a baby on the way. I was mostly a stay-at-home mom. Money was tight sometimes, but I had never known hunger. It looked an awful lot like the American dream. And yet somehow, within 2 years, my marriage had ended. I was emotionally and physically broken, left with only minimum wage income from a part-time job in retail. I had sole custody of my 2 kids, no child support. I was losing my house, my car, and thanks to stress and poor nutrition, my hair. My family didn't know this, but many times in our beautiful suburban house, we were without electricity. When the water would get shut off, we'd stay with my parents. When I'd gone too many days only eating what was left over on my kids' plates, we'd eat with friends or family. Now, my church group bought me groceries and a new coffee pot when mine broke. When I ate cheaply. I knew hunger and I gained weight. I developed an autoimmune disease. I got another job and worked nights. I was working hard, sometimes multiple jobs, but even with all that support, things were still so hard. Now, I had had a great upbringing. I never used drugs, never abused alcohol, grew up in a beautiful house in a safe neighborhood. Through all this, my kids never did without. They were never dirty. They were healthy. They had clothes and toys and a network of people who loved them. We were some of the lucky ones. We had a support system and a way out. But in the worst times, my family still didn't fit the narrative, the meaningless, harmful narrative we cling to about what food insecurity looks like, that stands in the way of actually making a difference. Because in America, hunger doesn't always look like hunger, but that doesn't mean we aren't suffering. Just a few miraculous years later, I found myself on the other side of things, running a local nonprofit with a food pantry. Now, this was entirely new territory for me, and I spent the first few months wrapping my mind around pretty much everything. Once I'd gotten my head around the magnitude of the issues and all the things we were doing about them, I started doing what I'd learned and doing my best and doing everything the way I thought it was supposed to be done. Only I was starting to sense that it really wasn't working. Not my efforts, none of it. When I broke it down, I could only think of 2 major problems. 1, we were doing absolutely everything wrong. And 2, nobody cared. Now, when I say nobody cares, I know you get this gut reaction that says, of course somebody cares because I care. And maybe you really, really do. But how often do you think about the fact that some of your neighbors are struggling to feed their families? Because statistically, that is an unavoidable truth. But it's not your fault that it's so hard to connect to. There's a pretty significant mess of reasons why people don't care about hunger, and some of them are political and some are cultural, and many are beyond the scope of this discussion. But from where I sit, some of them are pretty straightforward. For instance, when I was as green could be in the nonprofit world, and that was green, I attended a fundraising seminar about marketing in a way that was really supposed to get people to open up their wallets for a cause. I could distill this entire hour-long seminar into one point. This expert panel recommended we use something called poverty porn. Poverty porn. Unfortunately, that's a real term that exists, and basically it just means using sad, evocative imagery on our website and our materials to evoke this emotional response. Specifically, though, we were told that using pictures of diverse, sad children outperformed any other category of image in terms of raising money. Now, certainly, this is exploitative, underhanded, cynical, but the panel reasoned that the ends justified the means, and the room seemed to agree. Now, if you're appalled, I'm with you, but I also have to admit to you that I've done this myself, because it can be so hard to make people care. Because of this, we have cultivated a very specific image of poverty and hunger. And here's where I'm going to break a rule and ask you to get out your phones. Keep them on silent, but get them out. I'm really serious about that. I'm going to keep talking, but I want you to do a Google image search of the word hunger. So if you don't know what that means, just type in the word hunger in your search bar, find where it says images, and look at those. Have a look at what that looks like. You're going to see that some of these are stock photos. Many are journalistic and grainy, and they seem authentic, and in their way, they're beautiful and heart-wrenching. Tell me if I'm wrong, but I'm pretty sure it's going to be exposed ribs, distended bellies, big sad eyes, children sitting in the dirt, hands outstretched, reaching for that single bowl of rice. Now, this is reality in many places, and I don't want to undermine or make light of that, but in America, that's not what it looks like. Hunger doesn't even look like its own Google search. Now, probably a good time to put your phone away. Our collective efforts to fight hunger have curated an image so particular, so familiar, and yet for most Americans, so unrealistic that it is completely unrelatable. Now, just for a moment, close your eyes and try to conjure an image of what hunger might really look like here. You don't actually have to close your eyes, but do conjure that image, or try. How many of you found that difficult? Yeah, thank you. Good. It should be. It is. And the reason is that hunger looks like young adults coming out of foster care. It looks like young families, single parents, the elderly, the disabled, veterans, people who've lost their jobs or face bankruptcy or divorce or student loans or accidents or medical bills. You get the idea? Unfortunately, it's the pictures of children in third world poverty that move us. That may not be reality, but it's a heck of a lot more intriguing than a picture of me. The thing is, there's no one race, gender, size, ability that hunger picks on exclusively. But if I can't inundate you with backlit, mobile-optimized images that tug at your heartstrings, how am I supposed to tell you that I need you to care about this? I'm seriously asking. If you have an answer, find me. I think another reason it's hard to make people care about this is that, frankly, it's really difficult to give you good data, and I'm going to catch heck for telling you that. But right now, we are so hot for data, and rightly so. We want to see proof that what we're doing, what we're giving our money to, is working. But the nature of this work makes it difficult to collect the kind of meaningful data you're looking for. For local food pantries, we aren't talking about month-long or year-long sustenance. We're talking about providing food in emergency circumstances, those times when there's more month than money. Who hasn't been there? Health outcomes would be interesting if we could track them, right? But on a local scale, that would be prohibitively expensive and complex. But what about quality of life factors, like crime rates? You've got to know that at best we could imply correlation, and I'm just not interested in that. What we can and should do is tell you how many people we serve, how much food we give away, and what kind of food we give away, and offer you some window into what life looks like for those facing hunger. I know that's not sexy data. I know it's not information that is conspicuously leading towards you a solution for this problem, and that's what we really want, right? But the greater socio-political, economic, and cultural issues that allow poverty to exist in a first world nation aren't that simple, and they aren't going away anytime soon. And if we focus solely on sorting them out while ignoring the physiological need for good food, we're going to keep seeing people suffering and dying from poor nutrition. The last reason, and the hardest one for me to talk about, is the fact that the people suffering the most aren't necessarily emaciated or exceptionally thin. In many cases, quite the opposite. As a culture, we find it a lot more difficult to empathize with someone who appears to be obese. We blame the individual. We associate obesity with poverty and laziness while we're inundated with the message that thinness equals health, equals wealth, equals intelligence, equals success. You get the idea. So if we bother to care at all, we might be tempted to think that the solution is to fight obesity instead of fighting food insecurity. It's like we keep wanting to put hunger on a diet. Never mind the fact that 95% of diets fail. Now, those of us who consider ourselves enlightened about things like food access and food deserts wring our hands and we hope for policy changes. We seek these high-level solutions for the fact that Mountain Dew and Funyuns are cheaper than an apple if you're lucky enough to find one here. And we are, but while we wade through those swamps of bureaucracy, our research shows that 75% of our clients have recently had to choose between keeping their power on and buying food. Of the 25% who hadn't, most answered that it was never a choice, that they got food assistance because they knew once their power was turned off, the fees would cause an avalanche of expenses that would set them back even further. Now, last year, my husband and I did a fitness boot camp. You know about those. We were given shopping lists for each week, and for just 1 week, we spent about $400 on food. In a month, it's right, it's really healthy. In a month, that's $1,200, not to mention the cost of the boot camp. So to make this positive health change, it would cost a couple roughly $1,500 a month. Now, no matter who you are, that's a lot of money, but the average family we serve has a monthly income of less than $1,200. And yet we mock and shame and shake our heads at the results of hunger while we spend $20 billion a year on weight loss as a nation. Maybe it's because we have to work so hard to lose a pound that we find it hard to feel bad about people facing hunger. Which, candidly, brings me to what we as an industry were doing wrong. The fact that folks who are stretching a minuscule amount of money have to settle for purchasing cheap, unhealthy food, I can understand. But food pantries traditionally have served food that is just as bad. Shelf-stable processed foods. We're talking shelves of instant ramen, marshmallow fluff, nuclear orange cheese puffs. I wish I was kidding. I wish I was kidding, but that's what I found when I came into the industry. A few years ago, when we decided that for the 5 days a month, when we provide food for our clients, we wanted to contribute to their lives and not their deaths, we set reasonable nutritional guidelines. We quadrupled the fresh food we served. We created a free mobile farmers market to take produce into neighborhoods with low access and low income. We thought the community would come out in droves to support this. Health is such a part of the conversation these days, but aside from a few notable exceptions, we were wrong. In the same era when fat is the enemy, we are also encouraged to believe that healthy, delicious food is a luxury. I get asked, will they even know what to do with it? Do they even want healthy food? Isn't that expensive? First of all, we all have the same internet, and you can Google an eggplant recipe just like I can. And no, the community didn't rain down dollars. And yes, it was expensive, but it's making a difference I can see. It's exposing children to healthy food. It's filling nutritional gaps. It's creating cultural capital so that our clients and their families can know, the way you or I do, that we belong at a farmer's market, that we have a right to delicious, fresh food, and that we are worth caring for. Now, we're working with the community towards bringing exercise that's accessible to folks who can't afford the gym, who feel outside the fitness culture. We're bringing support groups for body acceptance and intuitive eating to places where caring for oneself has long been an out-of-reach luxury. When we made that surprisingly controversial switch to fresher foods a few years ago, we learned that our clients weren't eating terrible food because that's what they wanted, but rather because that's what we were offering. Cooking classes and education can help anyone develop a healthier relationship with food and themselves, but healthy food wasn't something we had to force on anyone. Our clients were literally starving for it. All we had to do was make it available. Hunger doesn't look like a stock photo. Fighting obesity is not the same as fighting hunger. Data isn't reality. It's an important tool, but there are things that we just know, and you and I know that we need nutritious food to do our best thinking and learning and performing. The food pantry in your local church, school, or that rundown business in the part of town you never visit is doing just that. In the long run, this thing we do, facing hunger in the tedious day-to-day ways we do, it's making a difference in people's lives. It enables people to focus on the daily work of being human, of learning, of growing, of improving their own lives, of living out their golden years without the pangs of starvation. Health is a gift we may only be able to offer one grocery sack at a time, but fortunately for us, it's a cumulative effort that creates an environment for health. Please also give your money to think tanks and initiatives that are working to solve world hunger. Run for office, open a grocery store in a food desert. I pray for the day when my job becomes obsolete. But keep in mind that in a universe with world-class physicians and no emergency rooms, people will die of bug bites and broken bones. Local food pantries are the emergency rooms of food security. To truly eradicate hunger in America, it will take nothing less than systemic wholesale change. But while people in white hats argue about numbers and initiatives and collaborative forces, small food pantries have an important job to do. We can't stop treating the symptoms while we look for a cure, but we can't do it the way it's always been done. We must ignore the conventional wisdom that says we serve whatever is cheap and shelf-stable and never turn away a donation of food, and provide food instead that we would feed our own families. We must restore dignity by eliminating red tape and bureaucracy, by allowing grassroots efforts to become entangled with our status quo, by working on the assumption that our clients are intelligent enough to know how their bodies want to be fueled. We must acknowledge that access matters, that until grocery stores return to poor neighborhoods or convenience stores that accept EBT also sell vegetables, that we must provide the access. We must consider that our neighbors are thinking, feeling, spiritual beings whose needs for pleasure and joy and respect are as real as our own. We must innovate ways to bring health at every size, intuitive eating, mindful movement, and delicious, nurturing food to our neighborhoods. Food insecurity affects 12 million people in America, and that means that if you leave your house, you look it in the face every single day. It's not some disembodied ethereal threat facing only sad-eyed children in remote villages. It's hiding in plain sight. It looks like me. It may look like you. You can't fat shame it into submission. You can't bootstrap it into compliance. You can't measure the breadth of its effects on your neighbors with a questionnaire. Hunger isn't a romantic notion. It's not a sexy cause. It's insidious and secretive, urgent and persistent. I am living proof that it doesn't fit the narrative we've constructed. We have to stop trying to define it in a way that makes it more palatable, more solvable, and do the hard things to meet it where it is. Because if, while we play political and intellectual chess with solutions, we abandon the urgent work at the front lines, we will sacrifice an entire generation to suffering in the process. Now give to your local food pantry.